Okay, my name is Laura Stringham, and I'm going to be presenting Sylvia and Daniel, which is Unit 3, Case R. So let's start here. Research suggests that there's a strong link between abuse during childhood on the one hand and difficulty establishing and maintaining emotionally satisfying relationships during adulthood on the other. The evidence from recent studies suggests that people who suffer physical, emotional, or sexual abuse during childhood are more likely to experience distress in their relationships as adults. So here's our relationship. We have Sylvia and we have Daniel. I don't have any information regarding their racial background, their employment, their religious affiliations. So for the sake of the case study, we're going to move forward assuming that these points are more or less irrelevant when it comes to me being able to work with them. They have been married for 6 months following a 3-month courtship with no fights. He describes their frequent arguments and her emotional meltdowns as the reason for their decision to seek counseling. Anything can precipitate a fight. The topics of argument appear very random to them both. Both are adult children of alcoholic fathers. Both of their fathers have passed away. Daniel is very close to his mother. He's the youngest of 3 children. And Sylvia reports that she was physically and emotionally abused by both of her parents. She has distanced herself completely from all her family. Daniel, however, enjoys spending time with his family. They've gone on numerous camping trips together already. Sylvia explains that she hates spending time with his family. She feels they don't accept her because she's not a member of their church, and she doesn't even like camping. So there. In the 3rd session of marriage counseling, Sylvia begins talking about trauma that she experienced as a child. Daniel's shocked. He thought he understood what it was like to have an alcoholic father, but realizes the extent of her trauma is far more severe than he imagined. Sylvia explains being life-flighted to the local children's hospital after her father stabbed her and threw her across the room. It's clear that Sylvia played the scapegoat in her family, while Daniel played the hero. What we're seeing here is this common trifecta of substance abuse in the part of Sylvia's father as well as Daniel's, followed by domestic violence and the resulting trauma. As I think about this case, there's several moving pieces to take into consideration. I'm concerned I have no information regarding the substance use of either Daniel or Sylvia, which can significantly impact therapy, especially considering that they both come from fathers who are alcoholics. Each of them will have experienced their own personal trauma as a result of their childhood, and both are deeply impacted by the dynamic that was established in their families of origin. I'm also thinking about their relationship, which is relatively new and is what brought them in for therapy in the first place. For the sake of the brevity of this presentation, and because Sylvia and Daniel presented for marriage therapy, I am going to consider their relationship to be my client. But seeing that Sylvia has begun to open up about previously undisclosed childhood trauma, I'm also wanting to attend to her specific needs at this moment. She's shown trust in the therapist and her husband by disclosing the severe abuse she endured, and I believe attending to that will support and add strength as we work with them as a couple. In therapy, I would always want to be sensitive to Daniel's experience, knowing that he was raised in a home with an alcoholic father and carries the weight of being the family hero. But because of the perceived stability and reported quality in his familial relationships, at the moment, I'm going to focus on attending to Sylvia's distress and the marital distress that they're experiencing. This is Bessel van der Kolk, the author of the book, The Body Keeps a Score, which is heavily quoted throughout this presentation. He said, how do we treat people who are coping with the fallout of abuse, betrayal, and abandonment when we're forced to diagnose them with depression, panic disorder, bipolar illness, or borderline personality disorder, which do not really address what they're coping with? He also stated the way we define their problems, our diagnosis will determine how we approach their care. Such patients typically receive 5 or 6 different unrelated diagnoses in the course of their psychiatric treatment. None of these will be completely off the mark, and none of them will begin to meaningfully describe who these patients are and what they suffer from. Based on the limited information I have regarding Daniel and Sylvia's symptoms, I didn't feel that a DSM-5 diagnosis was justified for either of them. Considering the severity of the abuse she endured, it's very possible Sylvia could be diagnosed with PTSD or an anxiety disorder, but I didn't feel that I had the information to justify it. I will be using EFT for my model and working with the couple, which already assumes a non-pathologizing stance. For this reason, I identified a number of Z codes that I felt applied to Sylvia and will move forward based on those systemic observations. So we're looking at a phase of life problem. She has been recently married, which is a significant life adjustment. She has a history of physical abuse in childhood, psychological abuse in childhood, a severe parent and child relationship problem, and relationship distress with the spouse or intimate partner. So first things first is attend to safety. I don't have any information again regarding substance use or drugs, so I'd want to evaluate that. And of course, I'd be interested in knowing ways that they may self-medicate or prescription medication history. I'm also wanting to look at coping strategies, particularly maladaptive strategies like self-harm or eating disorders. And considering the correlation between abuse and depression or suicidality, I'd want to evaluate for those things to ensure the safety of both parties prior to progressing in therapy. I also want to see what their resources are and what strategies they do have for managing the stressors that they live with. Although it wasn't initially reported, I'd also need to look at the domestic violence situation within their relationship. As far as mandated reporting, I don't anticipate this will be necessary. Sylvia and Daniel are both adults and their alcoholic fathers have both passed away, rendering it impossible to report Sylvia's abuse at the hands of her father. However, Sylvia has indicated that her mother was also physically and emotionally abusive, which is something to consider. She's over 18, of course, so we discuss whether her mother was ever reported for abuse, if it's necessary to do so now, and particularly take a look at whether or not the mother is currently living with children in her home. So here's a thought. If the people whom you naturally turn to for care and protection terrify or reject you, you learn to shut down and ignore what you feel. If your heart is still broken because you were assaulted by someone you loved, you're likely to be preoccupied with not getting hurt again. In fact, you may unwittingly try to hurt them before they have a chance to hurt you. As I consider this couple, my first thought actually just turns to Sylvia. Her husband, who she's only been in a relationship with for 9 months, didn't know about her traumatic childhood. She doesn't have any contact with her family. Stabilizing her as she starts to relive these memories is going to be important to me. Once we've evaluated for safety, my focus would be to attend to the therapeutic relationship. I'm assuming this process is already underway, considering that this is their third couple session and Sylvia's felt safe enough to disclose the extent of her abuse. Daniel's primary complaint that brought them into couples therapy was Sylvia's sporadic emotional outbursts of anger. So I want to find ways for her to regulate her emotions. The next slide is going to come up with some strategies that will address that. And I also want to see what her social and relational resources are. How do we cultivate the relationships that she has and expand those resources? It might be appropriate to encourage her to attend a group therapy. Choate Henson published an article indicating that psychoeducational group work can play a helpful role in the recovery of childhood abuse victims. Group therapy can also be an effective place to incorporate cognitive behavioral therapy with the goals of increasing that self-regulation we talked about and improving relationship skills. It can also help clients develop hope, normalize their symptoms, and reduce isolation and shame. I really like this quote. Traumatic events are almost impossible to put into words. It emphasizes the need to utilize many avenues to overcome trauma. Van der Kolk indicated in his book that taking action through enrolling in a self-defense class can be empowering for abuse victims and can help cultivate a sense of control while building appropriate fight or flight responses after the trauma of being abused as a helpless child. Body work through yoga or massage could be very helpful. The most natural way humans calm down our distress is by being touched, hugged, and rocked. You can't fully recover if you don't feel safe in your skin. So these are some ways that Sylvia may be able to start feeling safe in her skin and possibly include Daniel as a partner or even part of the treatment with yoga and massage. And of course, mindfulness can bring awareness to the interplay between thoughts and physical sensations that create meaning to Sylvia's meltdowns and anger and create a space for more appropriate responses to her triggers. The next things I encourage Sylvia to consider is EMDR. I'm going to be moving into working with a couple using emotionally focused therapy, and there's some indication that EMDR, when used in conjunction with EFT, can be effective in overcoming trauma. Within the EFT framework, EMDR was utilized to facilitate and deepen access to attachment emotion. EMDR is a process wherein the client can, they think about the memory or they experience the memory in their mind while Both sides of the brain take turns being stimulated, either by following the finger of a therapist and looking back and forth, putting on headphones and listening to a tone alternate between the ears, or holding vibrating paddles that take turns vibrating and buzzing. EMDR loosens up something in the mind brain that gives people rapid access to loosely associated memories and images from the past. This helps them to put the traumatic experience into a larger context or perspective. Because EMDR is almost entirely a process that takes place in silence, people may be able to heal from trauma without actually having to talk about it. Traumatic memories persist as split off, unmodified images, sensations, and feelings. To my mind, the most important remarkable feature of EMDR is its apparent capacity to activate a series of unsought and seemingly unrelated sensations, emotions, images, and thoughts in conjunction with the original memory. This way of reassembling old information into new packages may be just the way we integrate ordinary, non-traumatic day-to-day experiences. So it's important to note here before I move on that I am going to be focusing on couples therapy. And all of this is intended to be used to supplement that therapy for Sylvia. If Sylvia is in a position where it's appropriate for her to pursue individual therapy to work on her trauma, I would need to refer her to another therapist with whom I can coordinate care. So let's move on to attachment. When I think about Sylvia and Daniel's relationship, I view it largely from an attachment perspective. It must be terribly challenging for an adult to know how to respond to their partner in a loving and secure way when they haven't seen it modeled or had the opportunity to practice it throughout their lives. Safety and terror are incompatible. Our attachment bonds are our greatest protection against threat. Traumatized human beings recover in the context of relationships. Trauma will increase the need for attachment while undermining the ability to trust. That the attachment figure is a source of comfort and terror. For this reason, and because Sylvia and Daniel originally came for marriage counseling, it seems appropriate to move forward with emotionally focused therapy. EFT appears to be particularly appropriate for traumatized couples, perhaps because it focuses on emotional responses to this attachment. It's shown to promote each partner's ability to reach for each other and express the attachment needs and fears, as well as respond supportively to the needs expressed by their partner. A study focused on EFT for female survivors of severe child abuse perpetrated by a family member, which is Sylvia's exact situation, found that significant reduction in relational distress, showing EFT for couples as a viable option for helping clients connect with one another. I think after last semester, we're all fairly well versed in the tenets and assumptions of EFT, so I'm going to run through these very quickly. It's a well-documented, empirically proven model of couples therapy that takes a humanistic approach and integrates experiential methods with family systems theory. It relies heavily on attachment theory, as studied by John Bowlby, and assumes that love is an extension of childhood attachment to a primary caregiver. Happiness in romantic love is largely due to the safety and quality of the adult attachment bond. EFT views problems in the relationship through the lens of attachment insecurity and separation distress. Those are the problems that we're addressing. It's shown to be effective in a wide variety of couple structures, including same-sex couples and couples with varied ethnic backgrounds. Emotion is primary in organizing attachment behaviors. The client is the relationship, and a healthy relationship is a secure attachment bond. EFT therapists promote what they call effective dependency that empowers and supports autonomy in each partner as they turn towards each other in choice. Change does not occur through insight into the past, but the mechanism of change is the creation of new emotional experiences while in therapy. This brings me to my second set of goals, which are for the relationship between Sylvia and Daniel. In EFT, these goals are stated simply, but maybe a much bigger challenge to achieve. They are to create a secure attachment for both partners, develop new interaction patterns that nurture and support each other, increase direct expression of emotions, especially those related to attachment needs. So what does this look like? EFT is broken into 3 stages. The first priority is to create that all-important alliance that I referred to earlier. Then it's vital to identify the negative interaction cycle that Sylvia and Daniel have fallen into. Even though they indicate there isn't much rhyme or reason to when Sylvia becomes angry, there will be a pattern of behavior that precedes and follows these outbursts that we're going to want to map and track. Next, we'll work on identifying the underlying emotions that trigger Sylvia while constantly referring to the problem not as Sylvia or Daniel, but rather the problem is the cycle that's been created as each partner is trying to get their attachment needs filled by the other. Once we achieve this familiarity with the attachment cycle in this language, we're going to move on to stage 2, which focuses on changing the interactional pattern by helping each partner identify their attachment needs, accept the partner's experience, and encourage direct expression of needs to the other partner. So this might look like Sylvia identifying that certain behaviors lead her to feeling unsafe, which triggers that effective but destructive anger response. As she accepts that Daniel's reaction to her anger is not intended to further wound her, but rather maintain her own sense of safety, she can look at this interaction with a new light, hopefully. As her therapist, I would work with them in session to both directly express these primary emotional needs. So it might look like, when you do this, I am reminded of how my father would behave and I become frightened. What I need from you is to comfort me and remind me that I'm safe with you. So we are working towards this, not connecting these responses to identifying what's happening inside each of them, finding the words to express that, and then articulate that to one another in a loving and healthy way. Once the new patterns are established, stage 3 will conclude this relatively brief therapy by just continuing to facilitate these new solutions to old problems and consolidating these cycles that we've been working on. One of the reasons I like EFT for Sylvia and Daniel is because of the interventions, which seem particularly appropriate and sensitive considering their trauma, life experiences, and relational distress that they're currently experiencing. So validation is going to be important for both of them to acknowledge they're both having a difficult experience and that both of their experiences are very valid. Reflecting emotions, especially in conjunction with the empathic conjecture, can be really helpful in helping them grasp what can be vague. So when they say something to me, I can say, what I hear you say is this, and then maybe even push it a little further to see if I can help them find the words to express what it is that they're feeling. Evocative responding is going to try and take things from up here in the cognitive, these are the things that happen, and down what we call at my work the emotional volcano into those primary emotions where we can speak from an emotional level as opposed to a cognitive level. We'll also try and do that through heightening, which is pausing, staying with an emotion. If there's a word that seems particularly poignant, to repeat that word and intensify those responses so that instead of brushing it under the rug, we have time to process this and incorporate it into therapy. I'm also definitely going to want to attend to nonverbal communication, especially considering that Sylvia hasn't really talked about this trauma. I want to point to body language or these expressions as a means to identify these emotional responses that she's having. And then as there's a lot of arguing, we're going to want to focus on blame or softening, so that instead of she did this, he did that, we start to use softer words and become more vulnerable, and again, start expressing those softer emotions and feelings down the volcano. And this is also done through enactments, where, as I mentioned in the last slide, the therapist has the clients turn directly to each other and state what it is they need from their partner. So limitations of the models. Murray and Graves note that in a study of EFT for couples who are working with trauma, the therapy process can be really challenging for participants, especially related to emotional flooding and numbing. So this is a relatively brief therapy, but researchers recommend that therapists ensure the process move very slowly and address dynamics of shame and self-blame that come up a lot in trauma clients. And then, of course, EFT cannot be used if there's domestic violence involved. So we'll have to evaluate for that. And if that is the case, we'll have to throw EFT out the window and come up with a different treatment plan for them. So limitations to EMDR is it remains a controversial, though popular treatment for trauma. Studies are varied in its effectiveness in treating specifically childhood trauma. One study in The Body Keeps the Score stated that only 25% of those with a history of childhood abuse were considered cured after 8 months of EMDR, compared to 73% of the adult onset group that was studied. So this contributes to the author's conclusion that EMDR is a powerful treatment for stuck traumatic memories, but doesn't necessarily resolve the effects of betrayal and abandonment that accompany physical or sexual abuse in childhood. Also, the study I noted regarding EMDR and EFT used together focused on strengthening attachment bonds following infidelity, as childhood trauma is showing to require different attention when compared to adult onset trauma. The results of EMDR may not be consistent when working with Sylvia. Personal limitations and ethical issues. Of course, I'm not an EFT certified therapist, so I would want to work very closely with a supervisor to ensure that they are receiving the best quality care. Again, EMDR certification, I'd have to refer out or work in conjunction with another therapist. Van der Kolk did note that one of the lovely things about EMDR is it can help even if the patient and the therapist do not have a trusting relationship. Some personal concerns that I have is that I'd really have to consider whether I'm in a position to be an effective therapist for Sylvia and Daniel. I definitely believe that EFT can be helpful, but I acknowledge I have a bias towards it. Cognitive behavioral conjoint therapy, specifically for PTSD, has also been shown to be efficacious in working with couples with trauma. So my bias towards EFT may have an influence there. EFT is an emotionally intense form of therapy, which could potentially be incongruent with some cultural expressions of emotion. So I'd have to make sure that it was a good fit for both Sylvia and Daniel. And then, of course, although I haven't experienced this type of severe trauma that Sylvia has, I grew up in circumstances that are reminiscent of her experiences. So taking that into consideration, I would need to work closely with my supervisor to work through personal issues that may come up during therapy. I wouldn't want to fall into that slippery slope of using Sylvia's trauma in therapy as a means of processing my own. In that case, the AAMFT Code of Ethics for Referrals does state marriage and family therapists respectfully assist persons in obtaining appropriate therapeutic services if the therapist is unable or unwilling to provide professional help. Okay, that's it, everyone. These are my references, and I believe I am the very last person to be submitting this, which means that we are done. Congratulations to us all.